PGs working in outside hospital is an open secret. But how many of you know that you are putting yourself at risk? Can PGs really work in private clinics or outside hospitals during their residency? What does NMC rules say? What does state medical boards are saying? Most importantly, why are PGs working in outside hospitals during their residency? Why is government not providing appropriate stipends or delaying in stipends, which is leading the PGs to work in outside hospitals? Many issues will be discussed in this video. Many shocking and illegal things will be revealed in this video. Do not miss anything. This is Dr. Jashwant Tankala, MD General Medicine and a rheumatology resident and a part-time YouTuber, and I welcome you to my channel Dr. JTM. If you haven't subscribed yet, go subscribe it and let's get into the video. Let me talk about the PG residents who are working in outside hospital. What is the main reason for the PGs who are working in private clinics or any other outside hospitals is that lack of stipends or delay in giving those stipends. Many common people doesn't know what is the average stipend given to a PG doctor. It is between 15,000 rupees to 90,000 rupees from private colleges to government hospitals. But the sad reality is, in many states, in many medical colleges, especially the private medical colleges, the stipends are not being given to the PG residents, which is making their life and survival really difficult and leaving the PG residents with two options. One, they have to depend on their parents' money, and two, they have to look for passive incomes or work in other private hospitals in the late hours or whenever they find free time. 25-year-old adult depending on parents' money every month is not a righteous thing on this earth anywhere in the entire world in any country. And at the same time, not all parents are rich even though their son or daughter is a doctor. So it is very difficult for them to send money every month to their son or daughter. Cost of living has changed so much recently that a minimum of 20 to 25,000 per month is needed to lead a normal basic lifestyle for food, clothing and shelter. Looking at these financial struggles, PGs who are currently doing their residency are working extra hours for money. And when I asked few of the PG residents why you are working in the outside hospitals, isn't it ethically wrong? Many of them replied like this: Sir, the stipends are very low and sometimes the colleges are not paying us stipends for 3 months straight. How can we survive? One PG said, many of my seniors are doing it, I'm also doing it. What is wrong in that? And one PG said that I have to financially support my parents and family, sir. What should I do? I need money. And one more PG said that I need more experience and exposure in the hospital, where in my hospital there are no cases and infrastructure at all. I also need to learn, right? But when I asked all of them, this is ethically wrong, right? Why did you choose it? All of them have answered only one thing: I'm working in private clinics only after my duty hours. Nobody is getting affected, no patient is getting affected. Then why do anyone have to talk about ethics? From their point of view, they are absolutely right and they have a valid point and reasons as well. But many PGs do not realize that they are going to face many legal issues from NMC and their state medical board. Let's see what NMC is saying and what are the rules and regulations for PGs regarding this issue. In 2023, NMC have released new guidelines and rules and regulations for PG resident working hours and their study schedule and their practice in their hospitals, the stipulated allotted hospitals. All the PG residents must be working in the hospital that they are allotted. They should be available 24/7 in the hospital that they are allotted, or they also have to work in rural areas if the state medical boards imply. They will have certain working hours, rest periods and also leave periods, but they have no legal rights to work in outside hospital other than the medical college that they are allotted. Then what about the state medical boards and what are they saying? They are saying that they will be following all the rules implemented by NMC, and at the same time, any person who takes a long leave or uninformed discontinuation of work, then they will definitely be facing a disciplinary action. And if the institute finds that this particular person is working in outside private hospitals, then his stipends will be cancelled, and at the same time his MBBS registration will also be cancelled and he will be in danger legally. States like Tamil Nadu, Delhi, Maharashtra are having vigilancy on these PG residents. That means they are constantly monitoring these PG residents on who is working in the hospital and who is working outside the hospital. So be careful. Many PGs do not know this. When you join in the medical college through NEET PG counseling, you will be signing many documents. One such document is that in the complete 3-year tenure of PG residency, you have to work and stay in the hospital or the institute that is allotted to you. You are not bound to legally work in any any private clinic or your own hospital during the 3 years of your course, and that will be a contract bound and you have signed that contract legally. So if your college finds that you are working in any private hospital outside during the working hours or after completing the working hours, they have all the rights to legally sue you, and they will be marking on your certificates as professional misconduct, and they will debar or cancel your medical registration as well. This will make your life so tough that you cannot even find a job outside, and you will not be allowed to enter into NEET PG counseling. And all the PGs who are working in outside private hospitals, one more important point: if you make any medical negligence act outside your institute or any private hospital, then you will be solely responsible for whatever medical negligence that has happened, and your institute will not support you or will not provide any legal support, and they will just say that this is not our concern and he is not our person. So that means you have to legally fight all by yourself. So it's illegal to work in outside private hospitals or starting your own consultancy during the 3 years of PG tenure. I know money is an important factor and it has to be there for your survivalship, and stipends are very low, but at the same time keeping your future at risk is also not a good thing. For a short-term earnings of money, you can't put your long-term future at risk and face all these legal issues. And I don't say that this is completely a PG's fault who is working in outside private hospitals and it is only purely for money or clinical experience or exposure. This is a fault of the NMC and also government as well, because government is not vigilantly looking into whether the PG residents are getting the stipends or the stipend they are getting is enough or not. And at the same time, NMC is not strictly implementing rules and regulations for private colleges for giving the stipends at appropriate time and giving an appropriate amount of stipends. This is leading to PG residents working in outside hospital. Instead, they can implement strict rules and regulations even for the private medical colleges, and even the government and NMC should have strict rules and regulations before approving any medical colleges that do not have proper infrastructure or patient load, because many PGs are not getting enough exposure and experience during their 3-year tenure that is leading them to work in any other outside private hospitals. So NMC should always focus on the quality before approving any medical college. To overcome this issue, government and NMC should always support the PG residents financially and academically as well. And PGs, do not fall for this trap of working outside for money, because you will be keeping yourself at risk and your degree at risk, and your future will be completely disturbed with all the legal issues. Be mindful, be careful. That's it for this video. If you have any doubts or if you wanted to know any career opportunities or passive income options during your PG residencies, which you can do it ethically and also legally valid, then please do comment down. I'll be telling you and I'll be reaching you, or you yourself can reach me on my Instagram or through my email ID. I am displaying that on the screen. And if you love this video, please like, share and subscribe to the channel, and let me know what other content related videos you want from me and I'll be posting it. This is Dr. JT signing off.